Hello, we are Lab 2 Rising Phoenix, and our research focuses on the impact of health inequity that alters our eating habits. This research poster was made by Jonathan Zhang, Kelvin Reynoso Jr., and Nuhaa. Our research topic developed after we conducted our first research project on zip codes. After collecting information about health outcomes in different zip codes, we found that the location of where you lived affects your health. With this information ruminating in the back of our minds as we continued our days as biomedical research interns, we were eager to explore the whys behind where we lived affecting our health. After analyzing some research articles, we decided to focus on diet, which is one of the major factors that contributes to your health. With further extensive research, we found that an eating habit that consists of a majority of fast foods rather than homemade cooked meals can detrimentally affect your health, with increased risk to chronic conditions. It may seem that the easy solution to maintain a healthy diet is just to eat healthy food, but it is not that simple. The food environment where one lives influences their eating habits and in turn their diet. Different neighborhoods have different ratios of fast food restaurants to grocers, resulting in eating habits that affect the health risk of those individuals. People who live in insalubrious food environments may be unaware of the extent that their eating habits are indirectly being affected by where they live. The problem lies in the infrastructure of New York, where there is an uneven distribution of resources that limits the availability of healthy food options. Our goal is to bring awareness and change to those regions that are significantly impacted by food health inequity. We want to spread awareness through social media to garner a large audience and contact elected officials to push for infrastructure policy change.
Our hypothesis is that areas with lower ratios of fast food restaurants to grocers will result in healthier individuals than those areas with higher ratios. Our thought process was that since fast food is unhealthier than food from the supermarket, an individual who eats more fast food than grocery food is unhealthier and has increased risks of chronic conditions. Therefore, a location with a higher prevalence of fast food restaurants will create an environment where individuals have less healthy food options and are more inclined to consume unhealthy fast foods. We gathered our data using two ways. Our first way was through a primary source where we conducted a survey and sent it to a large base of survey recipients. With this data, we determined the different eating habits of the individuals in different areas. Our second way of gathering data was through a secondary source where we performed our own literature review to analyze, synthesize, and interpret data on comparison studies, research papers, and published data reports. With this research data, we identified the regions of unhealthier individuals and factors that may explain those unhealthy regions. By evaluating our data, we drew correlations between the infrastructure of those regions and the diets of the individuals who live there to determine regions at risk of health problems. Our results and findings were of that from a survey. Our survey question was, on a scale of 1 to 5, I often eat at a fast food restaurant over eating food I bought from the supermarket, with 1 being strongly disagree and 5 being strongly agree. At this moment, our survey results are currently pending, so analysis of these findings will be added on in the future.
Our research started by compiling the retail chain location data from the Center for an Urban Future to create a choropleth map of different regions in New York. We focused on the ratio of fast food restaurants to grocers and wholesale clubs to better understand the food health inequity in different boroughs of New York. The darker region signifies a higher number of fast food restaurants compared to grocers and wholesale clubs. Our data shows that the Bronx has the highest fast food restaurants to grocers and wholesale clubs at a ratio of 97:1. This means that for every grocer and wholesale club in the Bronx, there are 97 fast food restaurants. After researching about fast foods and their effect on our body, we found that a fast food diet contains high sodium, saturated fat, trans fat, and cholesterol, which can lead to an increased risk of high blood pressure, heart disease, and unwanted weight gain. Having knowledge of health outcomes of New York from our zip code project, we postulated that an unhealthy fast food diet from the high ratio of fast food restaurants to grocers and wholesale clubs in the county contributed to Bronx being one of the unhealthiest counties. From our literature review of Characterizing Saskatoon's Food Environment, the neighborhood-level analysis of in-store fruit and vegetable access by Sugandhi Del Canto, Rachel Engler-Stringer, and Nazim Muhajareen, we found that wealthier and higher socioeconomic status neighborhoods had access to healthier and more nutritious food options, while lower socioeconomic status neighborhoods lived in food deserts, where people had financial difficulty in acquiring healthy food. Higher socioeconomic status neighborhoods had a higher proportion of grocery stores, while lower socioeconomic status neighborhoods had a higher proportion of convenience stores. Socioeconomic factors include occupation, education, income, wealth, and crime, which are all affected by where you live. By analyzing the social and economic factors in New York counties from our zip code research, we discovered that the Bronx had the lowest socioeconomic status among the counties, and Manhattan had the highest socioeconomic status. With our zip code research and our literature review, we were able to determine that the Bronx, a lower socioeconomic county, was a food desert and had a lower proportion of grocery stores. This literature review supported our hypothesis that a lower prevalence of grocery stores would create an environment difficult to obtain healthy food options.
We analyzed the health disparities in New York by comparing eating habits of people living in different areas and how it affects their health. The Bronx is a food desert, and due to the environment they live in, they struggle to find affordable, healthy food options. The Bronx had the highest rate of fast food restaurants to grocers and wholesale clubs, meaning that individuals are likely to consume an unhealthy fast food diet over a cooked homemade diet from grocery and wholesale clubs. The unhealthy diet contributes to many chronic health conditions.
We aimed to improve the infrastructure of the Bronx community by contacting elected officials to implement more grocers and wholesale clubs in the Bronx. By spreading awareness through social media, we hope to inspire New Yorkers to choose healthier options from grocers rather than fast food restaurants. We are also proud of Mentoring in Medicine that we are with and support our research. Thank you very much for taking the time to watch our research presentation.